Action.
Come in.
Hello, Mr. JR. My name's Jacob. I'm a registered nurse. I'll be performing an exam with you today. So what brings you in today?
I just wanted to get a routine check.
Okay. All right. First, we're going to go ahead and do a cardiovascular exam. I will be listening to different parts of your body, touching different parts of your body. First off, let's get a little history so I can get a better understanding of your current health. Mr. JR, can you recall any significant medical problems with your heart?
No.
Okay. So no heart disease, anything like that?
No.
How do you consider your level of activity?
I've never experienced any chest pain, and I consider myself pretty active.
Well, that's good to hear. Staying active is a very important part of maintaining health. So no chest pain, correct?
No.
Okay. Any chest tightness or discomfort?
No.
Okay. Any shortness of breath?
No.
Palpitations?
No.
Okay. Any syncope, blackouts, faints, collapsing, or dizziness?
No.
Okay. Do you take any drugs, prescribed, over the counter, illegal drugs?
No.
Okay. Supplements?
No.
Okay. Herbal drugs?
No.
Okay. Have you had your cholesterol checked?
Yes, but I don't recall on the results. The doctor said I was fine.
Okay. Do you recall when you had this done?
Like 2-3 years ago.
Okay. How would you describe your diet?
I don't follow any specific diet. I try to cut down on the salt and the greasy food.
Okay. Yes, we can all improve on that area and continue to cut down this. Do you smoke?
No.
Anybody in your household smoke?
No.
Okay. Does any of your family have any heart conditions that you're aware of?
No.
Okay. All right, sir. Now we're going to go ahead and do a visual inspection. I need you to remove your shirt and get into bed while I go ahead and wash my hands.
Yes, sir.
All right, Mr. Rangel, go ahead and make yourself comfortable. Okay. First, we're going to go ahead and visually inspect the body. So we're taking a look first here in the face. We're looking at the lids of the eyes. We're looking at the lips, the earlobes. We're looking for discolorations, signs that he may have cyanosis. And now we're going to go ahead and check his ears first. We're going to look for creases in the ears visually. Can you turn it that way, sir? And this way. Okay, so there's no visual creases. We're going to go ahead and transilluminate to see if we can see them as well. Okay, no creases, which could be a sign of heart disease. No creases as well. We're going to go ahead and check inside the mouth. Can you please open your mouth, Mr. Runham? Okay, we're looking for any signs of infection, redness, irritation, which also can lead to further heart complications. Okay, now we're going to go ahead. Can you please turn your head to the left, sir? All right, now we're just going to observe here for any jugular vein distension. Okay, can you turn this way now? All right, very good. All right. All right, now we're also going to check the chest area here. Also, as well, when we're on the face, we're noticing facial hair, symmetry, any lesions, color, warmth. Okay, we're checking on both sides, making sure it's symmetrical. Now we're checking the chest wall, hair, color of the chest. We have, a brown chest here, which is appropriate for his race. We're checking temperature. We're checking rise and fall. We're checking the cavity here to see if there's any abnormalities. Okay, so the interior chest here is nice and brown. It's intact, no lesions, without any heavy bulges or retractions. Okay, now we're going to check his upper extremities. Okay, we're looking again at the hair. It's evenly distributed. Colors the same on both sides. Okay, we're going to go ahead and check temperature, the back of both hands. Nice warm temperature. We're checking all the way up through his hands. And like I said, we're looking at the color. It's appropriate for his race. Can you please extend your nails out, sir? Okay, both hands. Okay, so we're looking at the nail beds also. Trying to notice if there's any curling. We're looking at the texture. Are they gnarled? Also the presence and color. Okay, sir. And we can check also clubbing by doing a Shamrock sign. Sir, can you please put both your nails together like that? Okay. So we don't see any presence of clubbing here, so that's a negative Shamrock. Okay. And also we're going to check the capillary refills on each finger. It should be 3 to 5 seconds. So you press on the nail, you look down. So turn red, turn white and red again. Should be less than 3 seconds. Every finger here in the hand. Okay, and we have a brisk capillary refill there on every digit of the hand. Okay. Also, now we're going to go ahead and do an Allen's test. That should be done with each arm. We're going to go ahead and occlude the radial and ulnar arteries. Okay, can you make a fist, sir? All right. Now can you go ahead and open it? I'm going to release the ulnar. I'm going to look at the hand. It should return red within 3 to 5 seconds. Okay, sir. Can you close your hand again? Open it. We're going to release the radial, and it returns within 3 to 5 seconds. We're going to do that on both hands. So can you make a fist? Release it. So radial again. Good. All right, make a fist. And open it. And there's our ulnar. Okay. Now we're going to move on to the lower extremities. Again, noting both his legs are brown, appropriate for his race. Warm. We're going to check temperature all the way up through the thighs. Checking temperature throughout the body. Okay, it's warm. No edema. We're looking for lesions, ulcerations. Distribution of the hair is equal on both sides. Okay. Again, we're observing the nails again on the toes, which can be a sign of poor circulation. So nails here, no abnormal findings here on the nails. Also, like I said, the texture, color, and presence. So then also on the nose, we're going to check for capillary refills of each toe. Okay, we're looking at the soles of the feet as well while we're down here. Okay, we're going to go ahead and check for pedal refill. We're going to have you, can you please raise up both your feet, sir? All right, and we're going to go ahead and drop those now. And it should return within 10 to 15 seconds, which we did here. Now next we're just going to go ahead and check for a Homan sign. So you're going to flex up dorsiflex the ankle, and we're going to squeeze the back of the calves. You feel any discomfort, Mr. JR?
No.
And same on the other side. Any discomfort?
No.
Okay. All right, so now we're going to go ahead and get some vital signs. So there, we had brisk capillary refills to both extremities. The pedal refill was brisk bilaterally. And like I said, it was less than 13 seconds. He was negative Homan sign on bilaterally. So we're going to go ahead and check blood pressure. So I'm going to put this here again. And ideally, if you had a hospital bed, I'd be better off here on the other side. So let me just go ahead into the other side here so we can check the blood pressure. All right. I have a blood pressure of 128/72. So we're just going to come and write that down. All right. So now we're going to continue on. We're going to go ahead and check his carotid, and after that, we're going to check his pulse. All right, sir. So if you can go ahead and lean your head that way a little bit. So, okay. So the carotid pulses, we're going to go ahead and check those. Okay, other side, sir. Okay, so listening to the carotid, it was strong and regular without any bruits, and it's best heard here with the diaphragm. Now we're going to switch to the bell here, and have him exhale and turn his head and see if we can better hear any bruits as well. Okay, sir. Can you turn to this side, please? Okay. Can you take a deep breath? Now exhale and hold it. Okay. Same thing on this side, sir. Turn over. Take a deep breath. Exhale. Now hold that. Okay, so no bruits present. All right, now we're going to go ahead and check the apical pulse for 1 full minute. Okay, we're going to look for the apex of the heart, the point of maximum intention. All right, so we have an apical pulse of 80. Since this is the first time I examine Mr. JR, you want to make sure you do listen for a whole minute. Now we're going to go ahead and check the radial pulse as well, and we're going to compare those. Okay, and both were strong and regular, and at 80 beats per minute. Okay, um, and they were synchronized. So now we're gonna, we've already located the point of maximum intention, point of maximal impulse, which should be in the left midclavicular line, right here in the fifth intercostal space. Anything under 60, if we noted the pulse, that would be bradycardia. Anything more than 100 would be tachycardia. Okay, so now we're going to go ahead and listen to the 5 different spots of the heart here. First, we're going to hear the aortic area, which is going to be just right here in the second intercostal space, right here on the right midclavicular line, just right of the sternum. Okay, now we're going to go ahead and go to the pulmonic, which is here on the left-hand side, midclavicular line, slightly just left of the sternum, in the second intercostal space. Okay. And then we come down just slightly to the herbs, the ectopic, which is a second pulmonic, which is here the left third intercostal space. Okay. Then here at the fourth intercostal space here, we should find the tricuspid. Between fourth, fifth intercostal space. And the fifth will have the mitral. Okay, so we listened to all those with the diaphragm, so we wouldn't be able to hear the low pitches there with the bell. So we're gonna go back and do the same thing. Okay. So as we listen to all those different areas, we're trying to note any murmurs or any abnormal heart sounds, any S3s, S4s. Um, so we had a normal S1 and S2. It was regular rate and rhythm. The S2 was greater than the S1 at the base. The S1 was greater than the S2 at the apex. There was no splitting of the heart, no splitting of the heart sounds heard. There's no murmur. Like I said, no three or no S3 or no S4 here, and no friction rub. If when you're listening, you want to be listening for murmurs, and if you do notice, you want to pay attention to the different characteristics such as the timing, was it systole, pansystolic, or holosystolic, was it distally, presystolic. You want to know the location, radiation, the shape or pattern, the grading, the pitch, and the quality. Okay. Next, we're going to go ahead and check his peripheral pulses. Okay. So when you're checking peripheral pulses, you want to notate the pulsations on a grade of 0 to 4. 0 being absent, non-palpable. 1 is diminished, barely palpable. 2 plus is expected, appropriate. 3 is a full increased, and 4 would be abounding, and it can't be obliterated. Okay, so we're going to go ahead and start off with the different pulses. All right, so first we're going to start off with a temporal pulse. Okay, just right here on the temporal. Okay, we can feel those both present. Okay, you have +2, strong and regular. Check here the maxillary. Okay, +2, strong on both sides. Okay, we're going to go ahead and go down to his carotid. Okay, and these you want to definitely do one by one. See, so can you turn this way? There. There we go. So +2, regular rhythm. Other side. And we have +2, regular rhythm. Okay. Also, I had noted earlier that sometimes you can feel that apical pulse at the point of maximum intensity. So we can try to feel there, see if we can feel it. Okay. We're going to go ahead and go into brachial. And you also want to know the rhythm on both sides, comparing both sides as well. Okay, we're going to go into the other side here and check this side as well. Okay. I'm going to go to radial. So like I said, as we're checking them both, we want to check them counterlaterally and epilaterally. Okay. We want to check the radial and the ulnar. All right, we're at +2 on both there as well. All right. +2 at both. Then we have the femoral artery right here. Okay. You can check that on both sides here. Okay, we have the popliteal. It's a little bit harder to locate. You want to be careful. You don't want to obliterate the pulse as well, so you don't want to overly press. can also get the patient to move into a supine position if you need, if it'll help you better find that pulse. Got it there. All right. Now we're going to go ahead and check the two pulses here. We have the dorsal PDS. Okay. Here we're at +2, regular. And always comparing each side. And we have the posterior tibia. These ones you really want to be careful not to obliterate. You want to press real slightly on these. Here. This one's little faint there. 1. Okay. And then we have a 1 there as well. So that would be all our peripheral pulses there. Also, you're going to ask the patient about any sensations. Do you have any numbness or tingling here to your feet?
No.
Any pain? Do you feel the sensation here in the bottom of your feet? Yes. Okay. All right, Mr. Rangel. That will complete our assessment for today. You have any further questions?
No.
Okay. Thank you.